Hi everyone, my name's Dr. Ettensohn. Welcome to Heal NPD. I recently watched the movie A Real Pain, and I was struck by its nuanced portrayal of a character with a vulnerable narcissistic presentation. I wasn't totally surprised then when I saw that Dr. Ramani had made a video discussing this movie. In her video, she's positively exuberant, calling it, quote, the most beautifully nuanced portrayal of vulnerable narcissism she's ever seen. But here's the thing. While it's true that one of the characters in A Real Pain struggles with narcissism, Dr. Ramani incorrectly identifies which character it is. She points to the wrong one. Now, I know Dr. Ramani has a large audience who find her content very helpful. I'm not here to attack or criticize her. To be honest, her platform is gigantic, about 2 orders of magnitude larger than mine. Her platform amplifies her every word nearly 100 times louder than anything that I have to say. I emphasize this because anytime I mention Dr. Ramani, scores of angry commenters show up accusing me of attacking her, as though the world's most popular voice on narcissism needs to be defended against every disagreement. I want to clearly establish that she is a giant and I am an ant. That being said, I think a platform such as hers should carry a certain amount of responsibility. The downside of being at the top is that everyone hears your voice, including people like me, who are working very hard to clarify these concepts and to promote a destigmatized perspective on this form of mental illness. So let me get into this a little bit. And just to reiterate, my point here isn't that Dr. Ramani got something wrong, because that happens to everyone. My point is to explore what it is that I think she got wrong, and perhaps more importantly, why I think it happened. I think it's an example of conceptualizing and assigning labels based on superficial appearances and traits, and it's something that happens all the time when we're discussing pathological narcissism and NPD. In her video, Dr. Ramani misidentifies Kieran Culkin's character, Benji, as a, quote, vulnerable narcissist. She bases this on the following characteristics. He's charismatic, impulsive, and emotionally volatile. She says, quote, he's charming and charismatic, but then at times he's very dysregulated and abrupt. Sometimes he even just bursts into tears. She points out that he's a, quote, failure to launch, because he still lives in his mother's basement. And she emphasizes that when Benji feels shame, he doesn't get angry, he gets sad. And she says that this, too, is a hallmark of vulnerable narcissism. But none of these traits reliably describe vulnerable narcissistic presentations. Emotional dysregulation, sadness in response to shame, so-called failure to launch, none of these reliably describe what we might call vulnerable narcissism. I assess these conditions for a living. I specialize in diagnosing and treating pathological narcissism. We see all of these features across multiple forms of mental illness and multiple DSM diagnoses. None of them in isolation, nor in this specific combination, mean that a person struggles with pathological narcissism. Kieran Culkin's character more closely aligns with a borderline personality style, which is often confused with vulnerable narcissism. I made a video about this, and I'll link to it in the description. Individuals with borderline personality styles tend to struggle with emotional dysregulation, intense attachment ambivalence, identity confusion, and feelings of emptiness. I'll quote from the Psychodynamic Diagnostic Manual, 2nd edition, published in 2017. Patients with borderline personality disorder feel emotions that easily spiral out of control. They tend to catastrophize and require the presence of another person to help regulate their affect and be soothed. They have difficulties in feeling a sense of continuity in their own experience. They may shift from one self-representation or self-state to another without noticing the inconsistencies. They tend to stir up in others emotions that are similar to the ones that they are experiencing and/or emotions that they disavow in themselves. They also tend to feel an inner void, and they may enter dissociated states of consciousness. They may often be impulsive and tend to have trouble making and maintaining long-lasting, gratifying, close relationships and stable, satisfying work lives." End quote. While this description emphasizes traits, it's really describing a personality structure. That is, thoughts, feelings, and perceptions about the self and others that drive external behaviors in a characteristic fashion. Borderline personalities are seldom at ease with their experience of being a self. They alternate between states of internal emptiness that are caused by identity confusion, dissociation, and abandonment despair, and states of intense emotional activation where they can appear charming, gregarious, compelling, and full of life. In more disordered presentations, this personality style is called borderline personality disorder, or BPD. In the movie, Kieran Culkin's character of Benji exemplifies this personality style. He exhibits emotional dysregulation in response to perceived abandonment. For example, he attempts suicide after the passing of his grandmother. His presentation throughout the movie is disorganized, erratic, and impulsive. More than anything, Culkin's character of Benji gives the impression of someone who's lost in a sea of internal pain and confusion. He lacks a job, a stable home that he can call his own, a partner or spouse, any stable friendships, and a stable identity. And this is where Dr. Ramani's failure to launch observation becomes relevant. It isn't reflective of vulnerable narcissism, but rather the internal psychological disarray and identity confusion that characterize BPD. He likely can't hold a job because he's too impulsive and interpersonally provocative. While Culkin's character can be charming and disarming, he can also be exceedingly difficult and antagonistic. He tends to stir up strong feelings in those around him, feelings of pity, intolerance, beguilement, frustration, and concern. This is caused by Benji's poor interpersonal boundaries and the use of borderline range defense mechanisms, like projective identification. By identifying this character as a vulnerable narcissist, Dr. Ramani is attending to superficial traits, but not the underlying personality structure that drives those traits. She's prioritizing the fact that he's charming at times, egocentric, subtly manipulative or emotionally coercive, dysregulated, and that he experiences shame. She seems to believe that those qualities characterize narcissistic vulnerability. And while they can certainly go along with vulnerable narcissism, they aren't essential to it. Such traits are meaningless unless we understand the internal conflicts that they express. In the case of Culkin's character, Benji, they express borderline personality preoccupations and defenses. Again, we can't just go by appearances. We have to understand the individual's psychology to make meaningful diagnostic comparisons. Now, as I said before, there is a character in the movie who struggles with pathological narcissism, but it's not Kieran Culkin's character. It's Jesse Eisenberg's. Eisenberg's character is a very clear example of an individual with a narcissistic personality style that's organized at the low neurotic level of personality organization. I made a video series about the concept of personality organization, but basically, it's a spectrum of personality health. Eisenberg's character is organized in a mostly healthy range of functioning, but he's still preoccupied by narcissistic conflicts and concerns. So let's talk about the narcissistic personality style, particularly vulnerable aspects of narcissistic pathology. Narcissistic personalities are organized around issues of self-worth, compensating for damaged self-esteem with inflated or curated self-presentations. They're terrified of not being good enough, and this fear extends from early developmental trauma that taught them that they need to be, quote, good enough to be loved and accepted. The personality is organized around this mandate, hiding or dissociating parts of self-experience that don't measure up, while promoting a sanitized version of self that the person believes will meet with external approval. something that we call a false self. False self-experience is rigid, controlled, and sensitive to shame or humiliation. Individuals with narcissistic personalities experience high levels of envy. They're constantly comparing themselves to others to see if they measure up, but also because they can feel that they're isolated and that they're locked up inside, and they envy other people who are able to simply be their authentic selves. In some individuals, the narcissistic defenses of inflated self-image are much more prominent and robust, and we might call these grandiose narcissists. They still have all the internal injuries and issues, but they have managed to create strong defenses that externalize most of the fear and insecurity onto other people. Other individuals don't manage to create such strong, externalizing, grandiose defenses, and we might call them vulnerable narcissists. They still have internal grandiose self-images, but those self-images are more fragile, more prone to collapse under the weight of the individual's insecurities or envy of other people. Eisenberg's character is organized like this. Throughout the movie, we see the tug-of-war between his internal grandiose self-image and his external vulnerabilities. We can also see the ways that he's confined to a false self persona. Eisenberg's character is tightly controlled, living in accordance with rigid internal mandates about how he's supposed to be perceived in the world. He's always buttoned up, quick to apologize, quick to shut down disruptive feelings, and shamefully exposed when others see his authentic experience. In one scene, Culkin's character reveals to the group that Eisenberg's character once cried for a week because he was homesick. Embarrassed and humiliated, Eisenberg's character shouts at him. His internal sense of worth hinges on being seen as respectable, orderly, and responsible. Now, some might assume that this means he has an obsessive-compulsive personality style. Partly, I think this is just how Jesse Eisenberg comes across, regardless of the character that he's playing. But here's a crucial distinction. Obsessive-compulsive personalities are driven by fears and anxieties about loss of control. While such fears are present in Eisenberg's character, they're less prominent than the fear of humiliation, his feelings of envy, and his fundamental preoccupations about inadequacy. He's desperate to be acknowledged for his successes, his good, responsible behaviors. But inside, he feels isolated and cut off from humanity. His character's experiences often center on his attempts at impression management and his envy of Culkin's social and emotional ease. In other words, his envy of Culkin's authenticity. He resents that Culkin's character can simply be exactly who he is, that he can freely express exactly how he feels. In one particularly revealing scene, Eisenberg's character says the following: "I'm not okay. That's the thing. I take a pill for my OCD. I jog, I meditate, and I go to work, and I come home at the end of the day. I move forward. I'm sorry, I'm ranting. I'm just so exhausted by him sometimes. I love him, and I hate him, and I want to kill him, and I want to be him, and I feel so lame around him because he's so cool and he doesn't give a shit." Partly, this is an understandable rant from a character who's exhausted from dealing with Benji's dysregulated and erratic behaviors, something that many people who are close to someone with BPD experience. But notice how Jesse Eisenberg's character naturally veers into his feelings of envy. These feelings aren't about Benji, they're about him, and they tell us a lot about what motivates his character. Although he presents as meek and quiet, Eisenberg's character is persecuted by shame and resentment. He's constantly comparing himself to other people. He's struggling against depressive, narcissistic collapse the entire movie, while effortfully substituting a false self because that's the paradigm in which he's trapped. In his mind, he's constantly falling short, despite Herculean efforts to be good and responsible. What's missing for Eisenberg's character is a robust connection to his authenticity. He's spent his life substituting a self that he thinks others will like and accept, while becoming increasingly anxious, depressed, and angry. Nevertheless, there is covert grandiosity concealed behind his meek exterior. Internally, he believes himself to be superior to most people, a fact that's betrayed by this line. He says, quote, "I know my pain is unexceptional, so I don't feel the need to burden everyone with it." End quote. Now, this is a classic neurotic level slip. What he's actually saying here is that he does believe his pain is exceptional, and he wishes he could burden everyone with it. This is what he envies about Culkin's character. It's the self-imposed prison that keeps him locked in vulnerable narcissistic ruminations about everyone around him, that keeps him alienated and isolated and inauthentic in his relationships. To summarize, Eisenberg's character has a superficially obsessive-compulsive neurotic personality style. But when we look at the actual structure that drives his traits and behaviors, we see vulnerable narcissism. We see envy, inadequacy, covert grandiosity, inauthenticity, shame, hypersensitivity to slight, and false self-dynamics. This is an essentially vulnerable narcissistic presentation. I've encountered many people like this in my practice. The actual narcissistic character was right there in front of Dr. Ramani, and he was totally invisible to her. She didn't just mistake someone with a borderline personality style for a narcissist. She did so while ignoring the actual narcissist right next to him. And yes, I'm aware that we're discussing a movie and that these are fictional characters. But I've been careful here to lay out exactly why I believe Eisenberg's character is narcissistic and Culkin's character is not. I've laid out the rationale, my diagnostic considerations, and connected behaviors to underlying motivations and presumed personality structure. This is what case conceptualization is. It's not just saying, well, this sort of looks a certain way, so that's what it is. Culkin's character is charming, selfish, erratic, impulsive, and he feels shame. That makes him a narcissist, right? I mean, it's an easy mistake to make, and one that's absolutely reinforced by how our culture conceptualizes these issues. But appearances don't get you to the underlying personality structure. Without a theory of why a particular behavior is narcissistic, you mistake anything that vaguely resembles what you think narcissism looks like with actual narcissism, while overlooking actual narcissism when it's right in front of you. These issues are reinforced by the dominant psychiatric diagnostic paradigm in the United States, the DSM. My very first video on this channel discussed problems with the way that narcissistic personality disorder is defined in the DSM, which focuses almost entirely on outward appearances, arrogance, grandiosity, and entitlement. And in doing so, it reduces a complex structure to essentially a single factor that we might call grandiosity. This has led to a problematic construct that lacks validity. In psychology, validity is a concept that refers to how well a construct, like NPD, matches up to a real-world phenomenon. We've seen diagnoses in the past that lacked validity, and eventually they're either significantly revised or abandoned altogether. The diagnosis of NPD is a bit like this. It was revised in the 1980s to focus almost exclusively on grandiose symptoms like arrogance or entitlement. In the process, the concept was stripped of its internal coherence. Recent research attests to the impact of these changes. When we don't have a coherent theory of narcissism, we can't understand what's going on inside the person. As someone who's worked in multiple graduate psychology programs, I can attest to the ways that clinical training has become focused on symptoms and symptom management without an accompanying understanding of why the symptoms occur, why they make sense in the context of the individual's life, and how superficial traits are connected to underlying personality structure. These aren't just academic issues. They have real-world consequences. A poor structure, like NPD, that's so superficially defined that almost anyone who exhibits bad or abusive behavior can be described as a, quote, narcissist, can do significant damage. Let me repeat, This is not about Dr. Ramani. Her video is just a perfect example of how this happens, and an example of how even the world's most popular voice on narcissism can misidentify it. And I believe it's because our culture lacks a coherent idea of what narcissism actually is. The DSM itself lacks a coherent construct for NPD. When popular frameworks collapse narcissism into appearances, they reinforce stigma, and they leave people confused about what they're actually dealing with. If we want to understand narcissism, we need more than a checklist of outward traits driven by stigma, fear, and sensationalism. We need actual theory, a framework that explains what the behaviors are defending against, how the self is organized, and why grandiosity and vulnerability are always present and always alternating. Without that, narcissism becomes invisible when it doesn't look the way we expect, and it gets erroneously projected onto people who are suffering from entirely different conditions. Narcissism isn't volatility or charm. It isn't manipulation, shame sensitivity, entitlement, or even lack of empathy. It's a disorder of self-image and self-esteem. And until we ground our understanding in that reality, we'll keep making these mistakes and missing the truth when it's right in front of us. Okay, so that's it for today. Until next time, take good care.